Good morning, everybody. Welcome to the NHS Forest conference, and I'm very privileged to be the keynote speaker for today. My name is Alexis Percival. I'm the Environmental and Sustainability Manager with Yorkshire Ambulance Service. And I'd like to give you a bit of a rundown as to what biodiversity means to the NHS and how we can work together to increase the amount that we need on our estate. How do we go about making a biodiverse NHS? Our world needs climate action on all fronts, everything, everywhere, all at once. Antonio Guterres, the Secretary General of the United Nations, stated this a few months ago, and it's true. Biodiversity is a key part of this. And we need to work out how we can make our climate action and our biodiversity interlink together. The sorrow that a nation has felt over the past few weeks from the loss of the Sycamore Gap sycamore tree has exhibited our link to a solitary sycamore tree. But essentially, we are in the process at the moment of losing ecology across the whole of the world, not just in our own backyard. This 1,000-year-old tree was lost last week through a farmer just accidentally knocking it down. It stood in the same spot since the Battle of Hastings. We need to really, really seriously think about how we change our connectivity with biodiversity. In fact, we're in a stage at the moment that biodiversity is even more critical than it has ever been. As the climate strengths exhibit, we're in the process of superheating our world. But also, we're in the process of losing en masse our farmland birds, with a 55% loss in the past 40 years. And also we're losing moths like nobody's business as well, with an 86% decline. Even the blue infrastructure is losing all of our freshwater biodiversity. And since 1970, we've lost 83% of our biodiversity within freshwater. Global biodiversity across the planet is in steep decline, and we need to work out how we can link our climate action with a biodiversity action as well. The two are interlinked, and essentially we need to work out the direction that we go and how, as the NHS, we can help, and the health system, we can change this direction. In fact, the biodiversity crisis is at an all-time low. We've lost a devastating amount of wildlife, with 17% plant species in my patch alone since 1970s have gone extinct. 1 in 4 of our plant species have declined since 2000. 7% of our large moths have declined since 2000 as well. And we've got a massive decline in the number of breeding birds that have distributed across the UK. In fact, we've lost nearly 20% of our biodiversity, and we are in desperate need of trying to work out how we can save it. So, how is biodiversity connected to the NHS? It's connected in so many different ways. We have a potential to kind of reap huge amounts of health benefits from this. When we look at this diagram here, you can see that a biodiverse NHS has engagement. We're looking at what we can do to interlink our patients with lots of different activities, and the benefits come out of that as mental health. We've got green space, we've got air quality benefits as well. But biodiversity also leads to things like food growing and looking at what we can do to increase our biodiversity through insect species. And we can build in our biodiversity into our buildings, into our sites, into our green spaces. So we can reap the benefits from this. But in reality, how can we do that? And why do we need to do that? The Lawton report back in 2010 had a major impact in the way that we perceive wildlife species and wildlife corridors and the benefit of that, of how we can interlink with that. It stated that we need to highlight we need bigger, more connected wildlife spaces across the whole of the UK. England's Tree Action Plan also kind of highlights what we need to do there, but there, stuck in the middle, green surroundings for hospitals and schools. The benefit of trees in our landscape is key to this. Also, the recently released UK HACC report says that we need to promote biodiversity and we need to increase our food-based diets as part of this. So as we move forwards, we can see how much of an impact we can have. But when we look at the state of nature, we are in dire need of changing the way we operate. The State of Nature report was issued a few weeks ago, and it says we need to improve the way we conserve our species. We need to look at our nature-friendly farming. We need to look at ecosystem restoration and coordinate our response. And we are a key part of that within the health system. The Environment Act also is the big stick that we all need to be aware of. So as we kind of stroll around, we need to work out how we can change our biodiversity by mandating it. So the Environment Act actually says that we as public authorities have a responsibility to conserve and enhance biodiversity, agree on policies and specific objectives, and we also need to work on who complies with this as well. So government departments and public bodies, local authorities and statutory undertakers are all obligated to do this. And the timeframes? We all need to have a plan in place by the 1st of January. The NHS as a whole has an obligation to look at biodiversity duty, and we need to work out how we do this. But also, COP15, which is the COP to look at biodiversity, says we need to restore 30% of our terrestrial and marine environments by 2030. How are we going to do this? How can we do this in our estate, and how can we reap the rewards and the benefit from this? So, how can we increase biodiversity? I throw down the green gauntlets, the gardening gloves to all of you. How can you do it? How can you do it in your estate? How can you do it on your NHS sites, your GP surgeries, your dental surgeries? Nobody can do that. We don't have the green spaces. What are we talking about? So the first way of starting this process is to look at mapping. And some of our green estate have already started to look at what we can do to map out our green estate across the whole of the health system. By understanding what we have, we can then understand our biodiversity that we already got and what we can augment. So when you look at a hospital site, there's a lot of grey. Can we change what we plant, where we plant, our tree cover? Can we rip up some of those car parks? But also, where can we put things? Could we put some therapy gardens in there? Could we put green, cool spaces? Can we map out and change the way we look at our hospitals, our systems for health? The answer is yes. A key and quite astounding project that happened down at Great Ormond Street was the rooftop garden, which was highlighted in DIY SOS several years ago. It took this little tiny space on top of a hospital and looked to change it into a green, tranquil space where parents could go and sit and reflect on things, have consultations and get to escape from the hospital corridors. So we can change things from within. We can also build in biodiversity. We can, when we're physically building buildings, we can retrofit things as well. So bee bricks, swift boxes, bird boxes can all go up. We can also look at having bat roofs, and the impact is huge on everybody's in sight. You can see biodiversity literally outside your window. We can also put in other things that we can engage with our staff, engage with our local community, engage with local scout groups, bug hotels, bee hotels, lots of different places and different types of visual aspects that we can change that can inspire the other generations to look at what we can do. We can put in ponds, and ponds have always been a challenge within health systems, but it is noted that green infrastructure has lots and lots of benefits, but blue infrastructure also does. Little tiny ponds like this one, through to big spaces. The one on the right hand side I installed last week, and there are lots of benefits from that, from people just sitting and watching the wildlife that zooms around it. We can also invest in green walls that kind of have a benefit of taking air quality to a much higher level, but also they improve the look of buildings, and they also can protect and insulate buildings in a different way. Wildflower meadows on our sites, we can go from little tiny grass verges to really large parts of fields. And the benefits from this as well is a mental health impact for our staff, for our patients. It gets people outside, gets them walking on a lunchtime. Across the estates, there are so many inspirational spaces that have been planted up with wildflower meadows. In fact, this is a site at Pinderfield Hospital where they counted up all the plant species that they had, and within the space of an hour, they'd counted over 42 species of wildflowers just in their field next to their site. We also have the opportunity to put back in biodiversity by installing hedgerows and lots of different places that birds and wildlife species can go and hide in. But also, by changing the way we look at things, by having a no-mow May, a no-mow summer, we've discovered species that we never knew were there. In the middle was the pyramidal orchid, which has not been found outside of a hospital in many, many years. I discovered a group of different bee orchids located on 3 of my sites by just not having mowing regimes in place. So we've got opportunities to help and rescue and preserve different species, but also we can help the species that are on the brink of extinction. This is a fairly innocuous looking plant, the tansy. And in York, we are looking to kind of reinstate the tansy beetle, which is only found in York. 24,000 individuals have been counted, which is a really small population of beetle that can be wiped out in a flooding incident. But this little tiny iridescent beetle is a symbol of what we can do on our NHS sites and help to preserve what we have, but also play a part in our community in preserving our different species. Through NHS Forest, there have been thousands of trees that have been planted. This is my site in York, where we've planted over 2,500 trees. And they are all now, 3 years on, sprouting above the grass and above the cowslips. And it's an inspiration to walk around such a beautiful site. Across other areas, in Welsh Ambulance Service and various different NHS sites, people have been planting trees, a great engagement tool. And when you start to look at what has happened with the NHS Forest programme, you can see how much of an impact it's had. This NHS Forest plantation was planted in 2011, and 11 years later, these huge trees are there for staff to go and have a wander around and the public to enjoy as well. But also you can cram into a really small space, a tiny forest, and many, many species and different plants can help that, and the benefits for our staff are huge. We've got opportunities to preserve and grow our own food as well. So orchards have been popping up all over the place, and we've got a wonderful array of different orchards that staff have been planting. And at Welsh Ambulance Service, they've put in an orchard. We've put one at our AOC as well, and our Emergency Operations Centre, with a wide realm of different heritage apples for staff to grow and to pick as well. And this beautiful hospital orchard shows how much of an impact it can have with providing apples and pears and plums into our own hospital system as well. We've also got an opportunity for really small space growing with forest gardens, looking at what's below the ground, looking at things like chickpeas up to a herb layer, a shrub layer, a low tree layer, and then going into larger trees like sweet chestnut and other things. We can have compact space growing that can provide into our health system. But the key part of this is how we engage people with nature. When we start to look at Sycamore Gap, there's somebody who was very, very disconnected from nature and didn't understand how important that biodiversity, a lone single tree in the middle of a very sparse landscape, had on so many people and how many people's lives that could touch. But in reality, when we take biodiversity to people, we need them to engage and we need them to be part of that journey. So getting them to plant trees, working with the community, working with children, adults, mental health patients really, really can help provide that engagement. But also we've got sites that we can utilise to continue with the staff engagement, continue with community engagement. This wonderful site, our Health Meadows down at Uni Hospital in Llandoch, is an inspiration where they have meadows and orchards, and they have dead hedging courses, and they engage with their staff, their mental health patients, to kind of move them in a different direction. It's a complete inspiration, but it's about taking everybody with you. Many different hospitals are also looking at what they can do to engage their staff and their outpatients with growing food and connecting to nature. These spaces are really fantastic to link people in to what is on their doorstep as well. But for all of us, we need those mental health spaces and how we can connect into those inspirational green spaces going forwards. We've got health walks within our estate. We've got spaces where staff can relax and patients can go, and we're reaping those benefits. We're reaping what we can do to link our staff, our patients, to the spaces around our health system. But also, do we know what we've got? This amazing site at University Hospital Glenfield Hospital in Leicester is an inspiration. The Secret Garden was like this back in 2016, and now they've inspired so many people to get outside, to engage with nature, and they use it as part of their rehabilitation for staff and for patients. They've installed art installations, and people use it to kind of have their daily walks as well. So we need to engage, and we need to link in our nature that's on our doorstep, because essentially the climate and the ecological crisis is a health crisis, and the two are intrinsically linked. We need to link people to nature. As we move forwards, we need to go from the sparse mown lawns and move forwards to green spaces with wildlife, with insects, with trees, with plants, with stuff that's soil biota that is healthy, because we are literally destroying our nature if we don't, and we're destroying ourselves, because biodiversity is life after all. So I put a pledge out there to you and throw the green gauntlets down. How can we make our own healthcare biodiversity pledge? We need to restore, we need to regenerate, and we need to preserve. We need to plant trees, plant biodiversity, and grow life. We also need to create our own food security in a really, really unstable future. So we need to have these things within our health system on our doorsteps. But also there are health benefits that come from how we connect people into nature. We can increase our biodiversity by 30% by 2030, and we need to do this, and we need to do it now.